come in?
Hello, my name is Victorine and I am going to be a student nurse today. Okay? I'm just going to wash my hands and I'll be right back.
Okay.
I'm washing my hands for 20 seconds. Okay, and I'm right back. Okay, sir, can I please have your name and date of birth?
My name is Aveni Fokusituwe. My date of birth is October 16, 1984.
Okay. Alright, sir, do you know why you're here?
Yeah, I'm here because I had an accident yesterday. I fell on the staircase in my apartment and I hit my right shoulder.
Okay, so do you know where you are?
Yeah, right now I'm at the hospital.
Okay, and do you know approximately what time it is?
Yes, and it should be between 9 p.m. and 9:30.
Okay, perfect. Okay. Okay, sir, I asked you if you knew why you're here, but can you tell me what brings you in today? What is your problem today?
My problem today is I had an accident yesterday. I was in my house. I went upstairs to check my son because he was sleeping in the living room. After that, when I was going down to the living room, I fell on the staircase in my apartment and I hurt my shoulder. Since yesterday night, it's very, very painful.
Okay.
That's why I'm here today.
Okay, you hurt your shoulder when you fell.
Yeah, my right shoulder.
Okay, sir. To be able to assist you with the best of care, I am going to ask you a series of questions.
No problem.
After which, I'm going to do a physical examination of your body. And after the physical examination of your body, the doctor is going to come in and follow up with your assessment.
Okay.
Is that okay?
Okay.
All right. Okay, so you said you fell in the staircase yesterday.
Yes.
Okay. So, from yesterday to now, how can you rate your pain on a scale of 0 to 10?
Oh, on the scale of 0 to 10, I can say about 4/10.
Okay, about 4/10. Okay. And do you know if anything makes the pain better?
No.
Nothing makes the pain better.
Since yesterday, no.
Okay. And does anything makes the pain worse?
Yes, when I try to lift something.
Okay, lifting. Okay. And do you know if when you have the pain, do you have any associated symptoms? Do you have headache? Do you feel dizzy when
No, only the pain.
Only the pain.
Yes.
Okay. Okay, so now I'm going to ask you, do you have any allergies to food?
No.
No allergies to food.
No allergies.
Do you have any allergies to medication?
No.
Okay. And do you have any allergies to any environmental factor?
No.
No. Okay. No known allergies. Okay, so now I'm going to ask you about your medication. Are you on any prescription medication right now?
No.
No prescription medication.
No.
Do you buy or do you use any over-the-counter medication?
No.
No. And do you supplement your diet with herbal teas or
No.
vitamins? No, none of those. Okay, let's talk a little bit about your past medical history. Okay, do you have any history of hypertension, cancer, or diabetes?
No.
No. And do you have any history of anxiety or depression?
No.
None of those. Okay. Okay, let's talk a little bit about your past surgical history. Have you had any surgeries in the past before?
No.
Okay. And let's talk a little bit about your family history. Are your mom and dad alive?
Yeah, they still alive.
Okay, and how are they doing health-wise?
They are very healthy. They are doing well.
Okay. And do you know if there is any history of hypertension, cancer, or diabetes in your family?
No.
Okay. No history. Okay, sir. Let's talk a little bit about your social history. Do you smoke?
No.
No,
I don't smoke.
no smoking. Okay. Do you exercise?
Yeah, I exercise 3 times per week.
3 times per week. Okay. And do you drink any alcohol beverages?
Maybe 1 beer per week.
1 beer per week. Okay, so let's talk a little bit about your environmental factors. Do you work?
Yes, I'm a service technician for the apartment.
Service technician for apartments. Okay. And do you feel safe at your work?
Yes.
Do you think you're being exposed to any chemical or environmental hazard?
No.
None of those. Okay, sir. And at home, who do you live with?
I live with my fiance and my son.
Your fiance and your son. Okay, sir. So now I am going to check your vital signs, which means I'm going to check your blood pressure, your respiration rate, and your temperature. Okay?
Okay.
Alright, so in order to check your blood pressure, I am going to check your point of occlusion, and the point of occlusion is just going to let me determine how much or how far I have to pump to inflate the cuff. Okay? Alright, and I have to make sure that this cuff is the right size for you, and it has to be 80%, at least 80% in length, and at least 40% in width, 80% in width, and at least 40% in length of your arm circumference. And this matches your size. Okay. All right. Now I'm going to feel for your brachial artery right here. Perfect. Okay, and then I'm going to inflate the cuff. It's going to feel a little tight, okay? It's just going to feel a little tight, and I'm going to close my valve here, and I'm inflating, okay? All right, your point of occlusion is 140, okay? So, which means I am going to inflate, when I'm going to take your blood pressure, I'm going to inflate 30 millimeters of mercury above that limit, okay? All right, I'm just going to leave it here because I'm going to take your blood pressure in a few minutes. Is that okay with you?
Okay.
Okay, I'm going to check for your radial pulses, okay? And I'm going to do that on both hands, here and here, and I'm going to check for 30 seconds. Okay, sir, so your radial pulse is 34, okay, and I'm going to multiply that by 2, which is going to give me 68 as your heart rate. All right, now I'm going to check your blood pressure, okay? I'm going to put my stethoscope in. Okay, and I have to make sure that your legs are uncrossed and flat on the ground. Okay. Your point of occlusion was 140. I have to inflate the cuff to 170. I'm going to inflate now, okay? Okay, so your blood pressure is 122/75. Blood pressure is 122/75. And the normal range for a healthy adult like you, it's 119/69. So you're within the normal range. Okay, so that is good. Okay, so I am also going to listen to your heart. Okay. And for the purpose of this validation, I am not going to undress you, okay? So you're going to keep your clothes on, but I know that to listen to the best point of your heart sound is between the foot and feet intercostal space and at the mid-clavicular line, okay? All right. Now I'm going to listen for 30 seconds. Okay, perfect. And your heart rate is still 34, so that is good. Okay, so and you told me your pain level is about a 4 on 10, correct?
4 on 10.
And sir, do you know your height?
Yes, 6 feet 5 inches.
6.
5 feet 6 inches.
5 feet 6 inches. Okay.
Sorry.
That's all right. And do you know your weight?
Yeah, 192 pounds.
192 pounds. Okay. Okay, sir. Just breathe normally, okay? And I'm just going to assess your breathing rate here. Okay, you are breathing at 18 breaths per minute, okay? Okay, so now I'm going to ask you just general questions, okay? So how do you feel generally?
I feel okay.
You feel okay?
Yeah.
Okay, have you noticed any change, involuntary change in your weight, weight loss or weight gain recently?
No.
No. Okay, good. And have you noticed any sweats or chills at night when you sleep?
No.
Okay. And sir, this is just a question I'd like to ask. Have you had your COVID vaccine?
No, not yet, but I'm about to take it this coming week. I will just schedule.
Okay.
Yeah.
Okay. Schedule COVID vaccine. Okay, so I'm going to ask you a little bit about your head. When you fell, did you have any head injury? Did you hit your head?
No.
No. Okay. And sir, have you noticed any blurred vision recently?
No.
Okay. And have you noticed any bleeding in your nose?
No.
Have you noticed any change in your taste?
No.
Okay. All right. Okay, sir, I'm going to ask you a little bit about your neurological factors here. Have you noticed any headache recently?
No.
Okay. Have you ever had seizures?
No.
And have you ever noticed that you have loss of consciousness? Have you ever lost consciousness?
No.
Okay. Okay. Let's talk a little bit about your respirations. Do you sometimes feel short of breath?
No.
Okay. And sometimes, do you cough?
Sometimes, since my accident or before.
I mean, like an abnormal coughing.
During the flu season, sometimes I can cough, but like normal cough, that's not something I have to worry about. No.
Okay.
It's not really something I have to worry about it.
Okay. And when you breathe, do you feel like you're wheezing?
No.
No breathing. Okay. All right, let's talk a little bit about your neck here. Do you have any neck pain?
No.
Okay. And when you fell, did you feel like your movements were limited?
No.
No. Okay. And with your neck, have you noticed any sore throat?
No.
Okay. And have you noticed any, have you had any neck surgeries before?
No.
Okay. None of those. Okay, so let's talk a little bit about your heart. Do you have any pain, chest pain?
No.
Have you noticed any palpitations in your heart?
No.
Okay, and did you have any swellings in your legs or arms?
No.
Okay, none of those. Okay, let's talk a little bit about your abdomen. Do you have any abdominal pain?
No.
Okay, and do you go to the bathroom regularly?
Yes.
Okay, and when was your last bowel?
Like 2 hours before.
Oh, this morning before
yeah.
coming? Okay, okay, good. And have you noticed any change in taste recently?
No.
No, none of those. Okay. All right. So now I'm going to talk about your urinary. So have you noticed any pain with your urinary organ?
No.
No. And have you noticed any discharges or
No.
any uncomfortable odors?
No.
No. And do you have control when you want to pee?
Yes.
You have control when you want to pee. All of those. Okay, so let's talk a little bit about your musculature. When you fell, did you feel like you maybe broke a bone?
No.
No? Okay. And do you have free movement of your joints and your ligaments?
Yes.
Okay. And have you ever had, recently, have you had any contractures or spasm with your muscle?
No.
Okay. Okay, let's talk a little bit about your skin. So with your skin, have you observed any hair loss on any parts of your body?
No.
No. Okay, and have you noticed any eczema?
No.
Okay. And have you noticed any abnormal over sweating or over drying of your skin?
No.
None of those.
No.
Okay, thank you very much. Okay, so this ends the. So this first part ends the questions I have to ask you. Now I'm going to proceed with the assessment, the physical assessment. Okay.
Okay.
So to do that, please get down, cross your legs. Thank you. First, I am going to assess your nose. Okay. So I am going to. Can you just please sit comfortable? Okay. I'm going to assess your preauricular node bilaterally. No tenderness. I'm going to assess your postauricular node. No tenderness. And I'm going to assess your occipital, submandibular, submental, tonsillar, post-cervical, and supraclavicular. When I was palpating, did you feel any tenderness at any point?
No.
Okay, so now I'm going to check your trachea and make sure it's midline, okay? So I'm checking the trachea and I see that the trachea is midline and there is no deviation. When you swallow, do you have any problem swallowing?
No.
No. Okay, now I'm going to check your conjunctiva and I'm going to make sure that your sclera is clear with no signs of infection. No signs of infection. Okay, perfect. Okay, so now I'm going to check your cranial nerves and we are going to do a confrontation. Okay, so I'm going to close one side of my eye. Okay, I'm going to close one eye and you're going to close the same eye and you're going to let me know when you can see my hand. Okay, so use this hand to close this eye. Okay, and let me know when, look at my eye, look at my eye. Let me know when you can see my hand, okay? Just let me know just when you see, okay?
Yes, I see. I see. I see.
Okay. Then do same with this hand. Okay. Let me know when you see my hand.
Yes, I see. I see. Yes, I see.
Okay. Patient is vested with peripheral view. Now I'm going to shine this light into your eyes. Okay. You look at the light. Okay.
Yes.
And I'm going to assess for. Okay. Okay, pupils are equal, round, and reactive to light and accommodation. Now, please look at my finger. My finger, okay? Okay, extraocular movement of the eyes, of both eyes. Now, sir, I am going to assess your muscle here. Can you bite on your teeth? Bite. Okay. Now close your eyes, and I'm going to have assess. I need a piece of cotton here. Okay. Now can you please close your eyes, and you let me know when you can feel the touch of this cotton. Okay.
Oh.
Close your eyes.
Yes, I feel it. Yes, I feel it.
Okay, so you can feel, you have sensation on both sides of your face. Now, sir, I'm going to have you smile and frown. Smile and frown. Okay, movements are equal and symmetric on both sides of the face. Now, sir, I'm going to have you stick your tongue out. Stick out your tongue. Move left and right, up and down. Open your mouth and say ah.
Ah.
Okay, uvula goes up when you say ah, and there is no sign of infection or caries in your mouth. Your lips are pink and don't seem to be missing anything, which is perfect. Can you say the words light, tight, dynamite?
Light, tight, dynamite.
Perfect. Now I'm going to go on your side, okay, and I'm going to whisper some sounds, and you tell me what I've whispered, okay?
One, two, three.
Okay. And I'm going to stand on this side, and you tell me.
1, 2, 3.
Okay, perfect. Okay, now we are going to assess for the strength in your shoulders. Can you shrug your shoulders against resistance? Okay, perfect. Now you have to turn your head, and don't let me turn your head on your hand, okay? Perfect. Okay, strength is present and equal on both sides of the face. Okay, sir, can you please sit on, can you turn and sit on this side, please? No, just sit this way. Okay. Okay. Okay, so now I'm going to assess for tactile parameters, and I'm going to palpate 5 places in your back. And each time you feel my hand on your back, can you please say 99?
Okay.
Okay?
99, 99, 99, 99, 99.
Vibrations are equal and all over the back, which is perfect. Okay, now I'm going to listen to your lung sounds, okay? To your breath sounds. And I'm going to listen to 9 spots. And you breathe through your mouth in and out, okay? Each time you feel the stethoscope, okay?
Okay.
Okay, breath sounds are equal bilaterally. Now, sir, I'm going to test for the costovertebral angle. Okay, so I am going to stomp in your back and let me know if you feel any pain. Okay, so I'm going to test that. Just turn your back. Okay, at the 12th rib, at the end of the 12th rib, and the angle with the spine, which is right here. Let me know if you feel any pain, okay? Any pain?
No. No.
No pain. Okay, perfect. Okay, now, sir, I am going to focus on 5 spots in the back, okay? So just relax. 9 spots. So, that's 1. That's 2. That's 3. 4. 5. 6. 7. 8. 9. Okay. Percussion was equal and the vibrations felt equal bilaterally. Did you feel any pain when I was percussing?
No.
Okay. So you can sit back in the position I put you. Now I am going to inspect your neck and make sure that the skin is clear, no signs of hives, no signs of infection, even distribution of hair. I am going to palpate your carotid artery, okay, on 3 spots. Carotid artery is bilaterally present, symmetrical, strong, present, and rhythm is regular. Okay, now I'm going to listen, okay? And I'm going to listen with my bell, the same 3 spots. Okay, carotid pulse is present, regular, and strong. Now I'm going to listen to your lungs, okay? To your lung sounds. I'm going to listen supraclavicular, under the clavicle, and above the sternum. The sternum on both sides, above the clavicle, below the clavicle. Pulses is present, regular, bilaterally. Now I'm going to listen to your heart sounds, okay? And I'm going to listen first with my... First I'm going to inspect, okay? So I am not going to undress you for the purpose of this validation, but I'm going to say exactly what I'm doing, okay? So observing the chest portion, skin is warm to touch and symmetric, left and right bilaterally, and there is even distribution of hair. Now I'm going to listen to your heart sounds. And I'm going to listen first with my diaphragm in 4 spots. I'm listening to your aortic pulse, pulmonary pulse, tricuspid, and I'm listening to your pulse of maximum impulse, your point of maximum impulse. Perfect. Now I'm going to listen with my bell, okay? Okay, and I listen at the four same spots. Now I'm going to palpate for your point of maximum impulse, and that is going to be between the foot and the feet intercostal space and the mid-clavicular line. And I'm just going to feel here. Okay, so your heart sounds are normal. So now I am going to go ahead and assess your upper extremities. Okay, so on inspection, skin looks even, feels warm to touch, and there is even distribution of hair in both hands. Okay, now I'm going to check capillary refill in your fingers, okay, in both hands, and this is just to determine that you have effective blood flow to your upper extremities. Okay, so I'm going to assess here, and we have a capillary refill of less than 2 seconds, which is what we expect. Okay, so now I'm going to have you close your eyes, and I'm going to test for light sensation. Let me know when and where you feel this cutting, okay?
On my left arm.
Okay, perfect.
One hand.
Okay, keep your eyes closed and let me know which finger I am lifting, okay? That's your proprioception.
Left middle finger on my left hand.
Okay.
Middle finger on my right arm.
Okay, perfect. Okay, now sir, you can open your eyes. I would like you to do rapid alternating movements with your hand, okay? Go faster. Rapid alternating movement, present, symmetrical, and coordinated in both hands. Now sir, I'm going to test for muscle strength and range of motion. Can you lift up your hands and push against mine? Okay. Turn your hands. I'm going to try to pull. Don't let me pull. Perfect. Can you flex and extend? Flex and extend. Okay, perfect. Now hold your hands up. I'm going to pull towards me. Don't let me pull. I'm going to push back. Don't let me push. Can you flex and extend? Perfect. Can you hold your hands out? Okay, I know you said you have some pain in your right shoulder. How does it feel now?
I feel some pain there.
Some pain? Yes. Okay. So let me know when the pain is really hard. Okay, I'm going to try to push down. Okay, don't let me push down. Pain?
Yes.
Okay. Pain?
Yes.
Okay. We have some restricted movements on the right shoulder. Okay. All right. So there is strength and range of motion. Can you lift this hand up and down? Okay, perfect. And how about this one? Just do as you can. Can you try? Okay, there is. Okay, thank you. Restricted movement on the right shoulder and restricted range of motion. Okay, now sir, so I am going to go ahead and check your radial pulses in both hands, okay? You can actually have it right here. Pulses are present, regular, and strong. Now I am going to go ahead and assess for your tendon reflexes, okay? So, okay, all right. So, just relax your hand, okay? I'm going to assess for your triceps, okay? Your triceps reflex, okay? Relax your hand. Okay. Just let me carry all the weight, okay? Okay, tendon reflex present with the triceps. Now I'm going to check for your biceps. I'm not going to check in your right hand because you have some pain in your shoulder, okay? Let's do this. There you go. Okay. Biceps, tendon reflex present. Okay. Okay, now I am going to assess your abdomen. Okay, can you please lay on your back, your head this way? Okay, for the purpose of this validation, I am not going to expose any body parts, okay? I am just going to say what I'm going to do, all right? So I am inspecting the abdomen and the contour and symmetry. Our abdomen is flat and our abdomen is symmetrically equal bilaterally on right and left side. Now I am going to listen to your bowel sounds, and I'm going to use my diaphragm and listen to 4 spots, okay? I will start with the lower right quadrant, upper right quadrant, upper left quadrant, and lower left quadrant. Okay, there is tympani in all 4 quadrants present. Now I'm going to listen to your vasculatures, and I'm going to use my bell for that, and I'm going to listen to the 4 spots. Lower right quadrant, upper right quadrant, I'm listening to the aorta, upper left quadrant, renal, and lower left quadrant, iliac. Okay, I do not hear any abnormal sounds. Okay, now I am going to percuss. Okay, and let me know if you feel any pain. Okay, on 4 spots, on 5 spots, in epigastric area. No abnormal vibration or sounds heard from percussion. Now I'm going to palpate, okay? And let me know if you feel any pain on palpation.
No pain.
No pain.
No pain.
Okay.
No pain.
Okay.
No pain.
All right. Okay, perfect. You can sit back, sir. Thank you very much. Okay, now I am going to assess your lower extremities, okay?
Okay.
Maybe I need to move the camera for that. Okay. Alright, so I am going to push on your legs, okay? Don't let me push. Bring your legs out. Bring your legs out, yeah. Don't let me push down. No, sit so that you can dangle. Bring your legs. Don't let me push. Don't let me pull. Okay, don't let me push back and don't let me pull. Perfect. I'm going to assess for your arteries here on the dorsalis pedis, present regular, and then on the posterior tibialis. Perfect. And I'm going to assess for deep tendon reflexes here on the Achilles. Okay, and here. Perfect. Okay. And can you flex and extend? And for your knees, push back and forth. Okay, I'm going to do the same things for your hip, okay? Okay, can you lay back? Lay back. Can you push your legs in and out? In and out. Okay, don't let me push back. Don't let me pull. Okay, perfect. You can sit back. Can you please just stand and walk on a straight line? Can you walk back? Thank you. Sit down. And I'm going to assess for edema in your legs, okay? Legs feel warm to touch and no presence of edema. All right, sir, I am done with my assessment. Do you have any questions for me?
No.
Okay, so the doctor is going to come in and follow up with your assessment, okay?
Thank you so much.
Thank you very much. I'm going to wash my hands and exit patient's room.